Now, what is this obstructive sleep apnea? Well, do you know about it? If not, then stay tuned with me because we are going to discuss that in our today's topic. Namaste, my name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Today we are going to discuss about a very common yet not paid equal attention to a medical condition called as obstructive sleep apnea. We'll know what is this condition, who all are at higher risk of getting it, what causes this, what are the symptoms, how do we diagnose and how do we treat it, and if not treated on time, what are the possible complications it can bring. So stay tuned with me, we'll discuss that. So first of all, let's split the word sleep apnea. The word apnea means the shortness or a stoppage of the breathing, and sleep when you are about to sleep. So that means when you are sleeping for a short duration of time, your breathing stops. Now this condition is called as a sleep apnea. Sleep apnea is mainly of two types. The first one is a central sleep apnea or a CSA. Here the problem is in the brain. Your brain doesn't give a right kind of a signal to all the muscles of your chest and diaphragm and all the muscles related to breathing. And because of that, there is a stoppage of the breathing. And the second variety is obstructive sleep apnea. As the word says, obstructive means there is an obstruction, there is a blockage in the way of your normal airway passage. And obstructive sleep apnea is a very common sleep related disorder. Now, as I told you, very less attention is still given. Only when such a greater personality gets such a health problem, it comes up more into media and people actually want to know more about this condition. So obstructive sleep apnea is one of the very common reasons, and in fact, the middle age population and the middle age adults have a 4 to 9% risk of getting this condition. And as you age higher, the more than 65 years of age, this increases even up to 10%. During the obstructive sleep apnea, it disturbs your sleep because you do not get a sufficient amount of oxygen. And because of that, a person wakes up in the midnight with either snoring or a snorting or a sudden body jerk movements. And when such incidents happens again and again, over a period of time, it leads to into a condition like an OSA. Now let's understand who all are at a higher risk of getting OSA. So the very first is your gender. Men have a 3 to 4 times higher chances of having OSA compared to that of a woman. Second, it depends on what is your age. In a middle age population, 4 to 9% there is an increased risk of this problem. And as you age further, more than 65 years of age, for you to encounter this problem, chances increases by 10%. Third risk factor is your body weight. In fact, people who have overweight and obesity, they have a higher chances of getting an OSA. It also depends that if you have any family history of obstructive sleep apnea. So positive family history, again your chances increases. Your chances of getting this disease also increases if you have other health problems. Other health problems like a diabetes, problems like a thyroid problem, problems like that of your blood pressure and bronchial asthma, or any problem of your respiratory tract which causes your nose to get blocked. So chronic nasal congestion, these are also problems which can increases your risk. If we talk about the body habits, then if you have a habit of smoking and drinking, your chance of OSA increases. Your chance of sleep apnea also increases if you have a round face, or if your tongue is very large and very thick, and if you have a very short snout and a thick neck. Again, your risk increases if you have any other heart related problems. Then also you tend to get a sleep apnea more common. Now let's understand, if you have a OSA, what are your body symptoms? See, many of the times this disease cannot get equal attention because of the symptoms. Many people confuse that the symptoms are actually a problem of a sleep and not actually due to OSA. Again, this disease gets undiagnosed if you sleep alone without any bed partner. Usually it is found that when someone is sleeping with the other person, the OSA symptoms comes into more highlight, and those people bring the diagnosis of OSA more frequently. So what are the possible symptoms? So if you are sleeping with someone, your family member will tell you that you have a habit of snoring aloud. Secondly, your family member can also highlight that during the night time you are waking up. Or else in your own body, what symptoms you can experience? You experience that you are having difficulty in sleeping. Now what all difficulties can happen? So once you are sleeping and in the midnight you are waking up. Now this waking up, usually people don't understand it's due to OSA. So people usually assume that they are either waking up for frequent urination or to visit to the washroom. People many times wake up in the midnight with a dryness of their mouth or some kind of a sore throat, and they gulp a water and they feel that they are waking up for such reason. Many times when you wake up in the morning, okay, you find that you are not having sufficient energy to wake up. You still want to sleep. When you wake up, you are feeling tired. You feel that you have not slept enough. Many times people also have headaches. Also, due to improper and irregular sleep, people also have an acidity issue. Over a long period of time, this leads you into a condition of changes in your blood pressure and a high blood pressure or a heart related problem also. Now because you have not slept sufficient enough throughout the day, you feel very fatigued and tired and you want to sleep. So daytime sleeping is a very common among such people. And because you have not slept properly and you do not have enough energy, you find that your mood has changed, you find more depressed, you have more irritation and more anxiety. Many times people have a difficulty in concentration, and this can lead you into forgetfulness also. Over a long period of time, this obstructive sleep apnea can also reduces the libido or a sex drive. So these are the certain common symptoms which can happen if you or your family member has OSA. See, these symptoms are that of an adult, but it's not necessary that this problem does not happen in children. In fact, nowadays more and more children also gets an OSA. There are certain very peculiar symptoms which happens to the children. Now let's see what are they. So the first one is the bed wetting. You might experience that your child has suddenly started doing a urination while sleeping. You might experience that your child has developed a habit of grinding their teeth. Child might wake up in the night for no reason. You might experience that the child is having a difficulty in concentration and all his exam results are falling. There might be a change in the child's behavior. Many times such children also have a very weird or a change in their body position while they are sleeping. So all these sudden changes, you must pay attention whether your child is having OSA or not. Now what happens that OSA problem is also increasing in children due to many reasons. One such reason is a childhood obesity, which is increasing day by day, and that contributes to the OSA. Second, children also have a problem of their tonsils, and if they have enlarged tonsil, their risk of OSA also increases. Then there are certain congenital or birth-born diseases like a Down syndrome, then Pierre-Robin syndrome. In such syndrome, the children have a higher tendency of having OSA. Now let's understand what is the cause of the obstructive sleep apnea. Now before we understand the cause, let's understand our throat area. So see, in our throat area there are certain muscles, and these muscles supports our neck structures. The structures like your tongue, then your tonsil, then your soft palate, and a U-shaped structure called as an uvula. When these muscles relaxes. It causes the narrowing of the airway. And if the airway becomes narrow, the less air will reach to your lungs. And if the less air reaches to your lungs, that means less oxygen is reaching to your lungs. So what happens? Oxygen level in your body and in your blood starts dropping. But you are still breathing. So what happens to the carbon dioxide level? That will rise. So this creates an imbalance between oxygen and a carbon dioxide. And the moment this mismatch happens, the signal goes to your brain and your brain gets alert, and in this response the brain wakes you up. Now, so the moment you wake up, the muscle which were relaxed again becomes tightened and your airway again opens up. Now, when this process continuously happens, its condition is nothing but an OSA. Now, this fraction of the second which the breathing stops is not only one time. It can happen even up to 30 or more than that times per hour. And that happens throughout the night. And because of that, you continuously in the zone of a waking up and sleeping, waking up and sleeping. Many of the times you do not even realize that you are actually waking up. And many times when you actually wake up, you feel that you are waking up either to drink water or you are waking up to visit to the washroom. And since your sleep is so much interrupted and disturbed, you do not enter into a restful sleep and you don't get a sufficient sleep. So what happens the next day? You wake up with either headache or an acidity, you feel fatigue, you feel weak and are tired. And this entire is the major cause of the OSA. The second another reason for the OSA is that your body weight. Yes, in fact, overweight and obese people have a very higher risk of getting an OSA. If your body weight increases just by 10%, your sleep apnea risk can increase by 6 times. Yes, it can increase by 6 times. Now, another reason is a thick neck circumference. Now, the men who have a circumference of more than 43 centimeter and a woman with a neck circumference more than 38 centimeter are again at a higher risk of having the sleep apnea. Again, it also depends if your throat is very narrow or if your neck area is a very large, or if you have a round face, or if you have a hypothyroid, your risk of getting this disease also increases. Risk again increases if you have a diabetes or a blood pressure, or a heart problem or an asthma. Even a smoking and alcohol can cause a obstructive sleep apnea. Now let's see that how do we diagnose this problem. So see, if you or any of your family member has any symptoms which suggest that of an OSA or have risk factors like a OSA, then you have to visit to your doctor and speak to your doctor. Your doctor will first take a detailed medical history. Now in the history, we not only ask the question to the patient about the sleep and the sleep habit, but we also take a help of your family member and we ask them whether the person has a habit of snoring in the night or whether the person wakes up in the night. So once we have a detailed history, it gives us an idea. Second, your doctor might do a physical examination to check what is your neck circumference, what is your body weight, whether do you have any other problems which can lead you into other complications, how is your nasal bone area, whether do you have a septal defect or not. So all this physical examination is done. Your doctor will also ask you to do few blood tests to rule out a diabetes or other related metabolic health problems. Then a very important aspect of the diagnosis is a sleep study. In the olden times, the sleep study used to be performed either in the hospital or a medical lab, but nowadays even the sleep study can be done at home. So when we are going to do a sleep study, we are going to basically find out the many components related to your sleep. We will find out how is the air flowing into your respiratory tract. We will also find out what is the blood oxygen level. We find out that what is your breathing pattern. What is the electrical activity going on in your brain? How are your eye movements? Is there any physical movements happening inside your legs and in your arms? What is your heart rate? How is your heart activity? How is your sleep pattern? Whether have you woke up in the night or not? All these detailed elements we obtain by the sleep study. So this is the main method of diagnosing a sleep apnea. And if we know that a person has a sleep apnea, of course then there is a treatment. So let's see what are the possible treatments. See, treatments are many and treatment is mostly a case dependent and individual to individual. But more or less what are the general treatment I am going to discuss. And that the very first one is the knowing the cause of your sleep apnea. And the moment we know the cause of the sleep apnea, treating that cause immediately resolves the problem. As I told you earlier that this problem happens more in overweight and obese people, so the weight loss is a center stone of the treatment. In fact, even if you lose a 10% of the body weight, you will experience a lot of change in your sleeping habits and you will find that the sleep apnea is reduced to a major scale. Secondly, we also pay attention that we advise such patients not to consume alcohol and sleeping pills, especially in the night time. Third, a physical activity and exercise is always recommended because that helps in a better breathing. We also pay attention that whether do you have any other health problems, especially that of your nose and your respiratory. Many people have a nasal congestion. In such people, usage of the nasal spray relieves the problem. Another method is a sleeping position. If you have a mild sleep apnea, in that case, if you sleep on a one side, many people find a lot of improvement. Another cornerstone of the treatment is a CPAP machine. Now, what is this CPAP machine? CPAP machine is a machine which has an air blower and a mask. Now, this mask you have to wear over your nose and over your mouth area. And now this mask which you have to wear throughout the night. One end has a pipe and which is connected to the air blower. What this air blower does, it releases the air at a standard pressure continuously. And this pressure is sufficient enough to keep your airway open. It does not allow the muscles to relax and close the airway. So what will happen? The airway is continuously open and that's the reason why you will not have the sleep apnea. So sleep apnea, CPAP machine is a very commonly used equipment. Another method of treatment is the oral devices. Now there are certain oral devices which are available which are mainly used by those people who have a very larger tongue or who have a jaw issues. Oral devices are usually prescribed by a dental care professionals or a dentist. These oral devices, they prevents the blockage of the airway due to the tongue. Then we have a surgeries. See, before we go to the surgery, all other method of the treatment are usually recommended. But if none of those treatment is helpful or your major problem of your cause of your OSA is a problem due to some issue, then a surgery is advised. Let's say if a person has a very enlarged tonsils, then a tonsillectomy can be considered. Many people have a problem in the nasal area, what we call it as a deviated nasal septum, which leads to OSA. So in such cases, we advise the nasal septal surgeries and the issue resolves. So again, as I told you, the treatment is case dependent. You can speak to your doctor and your doctor will be able to guide you. Obstructive sleep apnea is one of the very common condition. However, if you don't treat it on time, it can lead you into a life-threatening complications. And what are those? Let's see them now. So very first complication is a daytime sleepiness which happens because you have not slept in the night. And because of that, you feel fatigued and tired throughout the day. These people have a higher tendency of falling asleep during the day. Now, how can this lead you into complication? Let's assume that if you are handling an equipment or a machineries, it can lead you into major accident. If you are driving a car or any other vehicle Again, this can lead you into complications of an accident, which can not only put your life into danger but others' life also. Then, because you do not have a sufficient concentration power, you tend to forget, and this can lead you into many other issues. Especially in children, when they are not having a right concentration, they find that they are failing in their exams and their overall health deteriorates. Sleep apnea is not only actually a problem of a person, but it in case also increases the chances of a marital fights. Yes, we have seen many patients and their family member and their spouse complaining that this person keeps snoring. And many a time they take this point on a very lighter note and they laugh it out. Rather, they don't seek a medical attention. And because of that, the husband and a wife, they start sleeping separately. They in fact even have a fights. And also this, because this problem leads into loss of a libido, again their relationship comes into a problem. So this is an interpersonal relationship also gets hampered. If sleep apnea is happening in a young woman who is pregnant, she has a higher chances of getting a diabetes during pregnancy, what we call it as a gestational diabetes. Such women also have a higher chances of delivering before the date or a preterm delivery, and they also have a low birth weight babies. Sleep apnea has also been associated with certain eye complications like that of a glaucoma. Now, glaucoma is nothing but a condition wherein your eye pressure increases and that can cause a irreversible vision loss. Then also dryness of the eyes is also associated. Sleep apnea can also happen if you have other metabolic health problems like that of a diabetes, then a blood pressure, high uric acid. The most threatening complication of the sleep apnea is that of a heart problem. See, what happens when you are not sleeping properly, the oxygen level in your blood drops. And the moment the oxygen level drops, it increases, shoots up your blood pressure. And this sudden rise of the blood pressure can cause a stroke or a sudden heart attack. It can also cause a disturbance in the rhythm of your heart. If a person who has sleep apnea is undergoing a surgery or for any other health reason, their chances of a complication further increases. What happens when you are undergoing a surgery? You have been given a medications like an anesthesia, then there is analgesics like painkillers and sedatives. So all of these medications, they causes the relaxation of your throat muscles. And at that same time, if you have an OSA, the problem increases further and your complications further increases. So if you have an OSA and if you are undergoing a surgery, you have to inform to your treating surgeon and a doctor so that your doctor can take action. So these are the certain most common complications which can happen due to OSA. I hope after watching this video, you got some good useful information. And if you are new to my channel, please don't forget to subscribe so that you will get a new and health related information. And then there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification. And if you have any of your personal question pertaining to your health, you can leave your question in the comment box below. I will try to answer them as early as I can. Namaste.